Hi, good afternoon, and thank you for joining us for this President's Town Hall at Virginia Tech. I'm Dawn Jeffries. I'll be moderating this afternoon's discussion. Today's focus is on fall 2021 semester plans. I'd like to introduce our panelists. Thank you all for joining us. First, let's start with President Tim Sands, Virginia Tech President, of course. Dr. Noelle Bissell, Director of the New River Health District. Frank Shushak, Vice President for Student Affairs. Mike MULHARE, Assistant Vice President for Emergency Management, and Marie BLISS, Assistant Vice President of Human Resources Administration. Thank you all for joining us. I appreciate it. You know, a lot of questions coming in from parents, from students, wondering about the fall semester, and more specifically, some changes that were recently announced. And President Sands, I'll start with you and just asking about the vaccinations. We've been talking about getting our COVID vaccines. You announced last week that students would be required to get their COVID vaccination before returning for the fall semester. Can you talk about that decision a little bit? Why the mandate?
Well, I'll talk about it at a high level, and then we'll get down, I'm sure, into some details. But first of all, I'd like to thank the employees, the students, and the community at large for really listening to the public health experts, following the protocols that were laid out, especially with respect to distancing and masking, that allowed us to have an academic year. And we struggled through it, we got through it, but if it weren't for that commitment to one's own health and to the general health of the community, that balance, we would have not gotten through the year like we did. So I feel really good about, considering the situation, how we came through that last academic year. We're asking everyone to do the same thing this fall. In other words, to do what's right for your own health, but also to think about the well-being of the entire community. And we have a new tool, and that's vaccination. And that tool is very effective. And what it allows us to contemplate and to plan for is a fully in-person fall experience. So back to 66,000 people in Lane Stadium, to full occupancy of our classrooms and our laboratories, to using the dining halls, full occupancy of the residence halls. This is really something we've been craving for months, and we have now the opportunity to do that. So we're encouraging everyone to be vaccinated who can be vaccinated. And the result of that is not only protecting your own health, but also protecting the health of the community. And I can go into some detail, and maybe we'll do that a little later. I'd like to have the experts on our panel get into this, but we do quite a bit of modeling and simulation. We've got some of our faculty experts involved in this. Of course, we have access to the public health expertise in the area, and in the national story as well. So we have a lot of data from the academic year, and we're pretty confident that if we can get almost everyone who can be vaccinated, we will be able to open up full bore for the fall, and that's the goal. We really need to come back. We know that the quality of the educational experience is dependent on having the option to come back more in person. Everything that we all think about when we think about the Virginia Tech experience requires the ability to come in person, and we have that ability now.
And Dr. Bissell, I want to come right to you with this first. We've had a number of town halls like this one, which, by the way, this is the first time we've been in person in quite some time, which is quite nice. Yeah. But you've talked about the safety of the vaccine before. Can you talk about that again? And also, there's been a lot of discussion most recently in the last week or so about the safety of the vaccine, particularly for males, particularly for a specific age group, as it results to some questions or concerns about a heart condition connected to the vaccine. If you can talk about that, because I know that's a question that's on a lot of people's minds right now.
So yeah, I mean, I think let's get back to vaccines are one of the greatest public health tools we have in communicable disease, and they save over 8 million lives every year. These vaccines, the vaccines we're talking about, have been administered to billions of people worldwide. Our cases in the United States, where we have been very effective relatively compared to a lot of other countries in getting people vaccinated, and look at the New River Health District, our cases have plummeted. Our hospitalizations, severe illness, and death have plummeted, and that's all in response to the vaccination. We immediately targeted our highest risk individuals to get vaccinated, and that's the result. So when we talk about the vaccines, they are very, very safe. They've been administered. Nothing was cut in the safety profiles, the clinical trials, when they did the vaccines. Nothing is totally risk-free. You can't say that doing anything, including taking a vaccine, is risk-free. However, you have to look at the risk of the vaccine versus the risk of not getting the vaccine and the risk of COVID. The CDC, the FDA, they are doing all the appropriate things when it comes to vaccine safety. Remember, we're living this real time. It's not like we're looking back on it and saying, oh, we need to look at this. So we're living it real time. They have seen some evidence of the myocarditis, and they're investigating it more. I would caution people, correlation is not causation. There's still much we need to learn as we live it real time. And the CDC, pediatric infectious disease experts, and pediatric cardiologists continue to recommend that the vaccine be administered to those who it's approved for, 12 and up, because they feel that the risk of the vaccine is much, much lower than the risk of COVID. And when you look at the myocarditis or the pericarditis, first of all, there are lots of other things that can cause myocarditis and pericarditis, other infectious diseases, enterovirus, adenovirus, Coxsackie virus, things that people are exposed to all the time. One of the most effective vaccines we ever had was the smallpox vaccine, and there was some association with myocarditis, but it was one of the most successful vaccines we ever had. So we accepted that limited risk for the success of that vaccine, and we were able to eradicate smallpox. The other thing with the myocarditis and pericarditis from the vaccine, in by and large, most of the cases, it's very, very mild. They recover uneventfully and have no long-term sequelae. It's very easy for them to get through. However, looking at COVID-caused myocarditis and pericarditis, and that hasn't been well documented. They definitely need to go look at more data, but in just 38 cases, they had 5 deaths of COVID-related myocarditis and pericarditis. So far in the vaccine, a couple of hundred cases, they haven't had any deaths. And the people that were more severely affected had other comorbid conditions. So you have to look at that as well. And then the other thing you have to look at is the syndrome. I mean, our young and healthy population wants to think, and in most cases they're right, that they're going to do fine with it. However, again, with vaccine associated, we're talking a couple of hundred cases, yet there have been thousands of cases of MISC, the multisystem inflammatory syndrome, associated with COVID in that same population, and hundreds of deaths associated with it. So again, when you look at that risk benefit, it's still far in the favor of getting the vaccine, and nothing's risk-free. So you do have to weigh that risk benefit. And this is a population, we look at vaccines for 2 reasons, protect against severe disease, hospitalization, and death, and it's proven that it's doing that. And then the other thing is preventing transmission. And people who are at higher risk of transmission, people who are in more congregate, close settings, who are more social, are at higher risk of transmitting the infection. And that whole concept of herd immunity is to get enough people vaccinated so that those who can't be vaccinated are protected, because there's less virus circulating. And that's so important in a college setting, in a congregate setting. And we do want everyone to get back to a normal college experience, and the vaccines are the way to do that.
Okay. President Sands or Marie, you may take this as well. We've said students are being required to get the vaccination, but employees are not. Can you talk about the difference there and why employees are not under the same requirements?
Well, let me just maybe give some general statements, and then Marie can fill in and augment them. But just these are tough decisions. These are not decisions made lightly. We spent weeks and weeks studying the situation, looking at options. And the reality of the student requirement for our population, which is in a dense living situation, not just on campus, but off campus as well, is that we know from our experience from the fall and the spring that the disease will propagate rapidly through those populations. And as Dr. Bissell said, it may not be an issue for an individual. They may get through the experience with COVID. They may not even know they had it. They may have just gotten a positive test and had no symptoms. but they could still pass the virus along. And we were successful, I think, over the last academic year in preventing the movement of the virus from our student population into our employee population or into the community. That I think that's largely due to the masking, the distancing, and the fact that we just didn't occupy. We went remote to a large extent, not completely, but in a lot of our functions we went remote because we didn't want to see that transmission. We think going forward that we need to have the student body almost entirely vaccinated in order to prevent the virus from propagating there. Now you think about what we're trying to do for the fall. We're going to remove a lot of the public health measures that kept everyone safe over the academic year. We want to get back to normal. That means we're going to have less masking, less distancing. We're going to have people living in more dense arrangements. So if we don't do something really active to prevent the virus from propagating among the students, we're going to be back in a much more difficult situation than we were over the last year. So for the students, we decided based on the data that it is really important that everyone's vaccinated. And there will be exceptions, but as Dr. Bissell said, to protect those that can't be vaccinated, everyone else who can be needs to be vaccinated. For employees, it's similar, actually. The employees are more likely to have a serious reaction to COVID. But our experience over the last year was that it did not propagate among our employees at a level comparable to the students. So we felt pretty good that we could do well there. We got about a 90% response from those who answered our survey earlier a couple months ago from employees that they had either been vaccinated or were in the process of being vaccinated. 90% is pretty good. If that's where we're really starting, and we don't know that for sure because there are always those that don't respond, and we don't know what their answer is going to be to that question, we feel pretty good about the employees. The other thing that complicated it for employees is that we do not think we have the ability from a legal point of view to require vaccinations for the employees, especially for a subpopulation of classified staff that are protected by a different set of rules and regulations. And we didn't feel that we could have one group among the employees have a mandate and the others not. So we're going to manage it, and if we have to change direction based on the responses we get from the vaccination entries that we're asking people to submit, then we will change. But we think we have a manageable situation going in. And maybe Marie could say a little bit more from the HR perspective.
Certainly. Well, we appreciate that so many people responded to the survey at 90%. And now we're looking for the actual numbers so that we can track this information. So it's very important for employees to understand they're part of this community and that we all want to come back and work together and enjoy being here. We need to see the proof that the employee has been vaccinated. We have a location on our Ready site for them to upload their information. And some may also have medical or religious reasons that exempt them. We encourage them to pursue that route through the Office of Equity and Accessibility. We're all in this together. We want to win this together.
I want to touch on more of that as we move on, but I wanted to ask you, is the process the same for uploading that proof of vaccination for faculty and students? What is that process like for showing?
I'm familiar with the employee upload. Maybe someone Frank can take the student one.
Yes, students will upload the request for a medical exemption or religious exemption or their vaccination verification all through the Shifford Health Center portal. So a little different for students and employees.
Sure, and there's a deadline for doing that. I think August 6th.
August 6th, yes.
Right. President Sands, I wanted to ask you because this is, and it's interesting, Dr. Bissell, you talked about things evolving and this happening in real time and following the data and following the science. But earlier this year, the university shared that it would not be able to mandate the vaccine. And I'm wondering if you can help explain why the change, what changed to make that decision adjust?
Well, earlier in the year, and we actually have a lot more data and a lot more understanding of COVID and also the regulatory environment that we're in than we did when we were hypothesizing back then that we would not be doing that until we got full FDA approval for one of the vaccines. But we've gotten to the point now where, with an opinion by the Attorney General of Virginia that is allowing us to go ahead and mandate it, and also looking at the data. We're running, what is it, 170 million or something like that people have been vaccinated or received, I think it's 170 million right now in the U.S., and that's an extraordinary number. You can just see that we're moving in a direction where the vaccine's going to be proven safe. And the other factor that waiting for FDA approval, which I think is going to come, but I'm not an expert in it, we don't know that, that if we waited that long, we would not be able to start the semester in person. So it's a difficult decision, but we had to make that call. Like most of our peers in Virginia are doing the same thing, because otherwise we're going to be late and we're not going to be able to go.
And Marie, you touched on exemptions. I'm wondering if President Sands or anyone really, if we can talk a little bit about the exemptions from which you would be excused from having to meet the requirement of getting a vaccination. What are the options?
Well, I think I'll let Dr. Shushak respond to that, because he's right in the middle of it for students.
Sure. The two key ways that you can receive a medical exemption is, first, a medical exemption, which requires that your physician sign off on that exemption. It's notarized and uploaded into the Shifford Health Center portal. And the second is if you have a sincerely held religious conviction that you should not be vaccinated, then there is a form that needs to be notarized and is also uplifted into the Shifford Health Center portal. There is a very small group of graduate students who may have a completely online course schedule or doing 100% research that won't be coming to any Virginia Tech campus that can also receive an exemption. But those are the three things. The two primary are medical and sincerely held religious conviction.
Dr. Shushak, if I could just point out something that I think needs to be said, is that if you get an exemption, you're still in the testing protocol. So that does not excuse you from testing. That exemption is for the vaccine. And so if you're going to have an exemption, assume that you're going to be in our testing protocol. And we'll see how that shapes up. Maybe Mike can say a little bit about what the factors are coming into deciding what that's going to look like.
Sure, be glad to. The one group, it may not be part of that testing group of those that are 100% online, but the other two is certainly part of our testing program. And we're looking at we're finalizing the testing program now for students and employees, and we're looking at a very rigorous testing program for those groups. We're at minimum perhaps weekly testing, whatever it takes to make sure that we can ensure that we have an environment that allows us to function in the fall. So again, that will be out shortly, but again, a very rigorous testing program to make sure that we can operate in the manner that we want to this coming semester.
I wanted to go back. Go ahead.
I'd like to add to that, it will work the same way for employees.
Yes.
Those who have an exemption will still be part of the testing surveillance, as well as anyone who did not upload their document indicating that they have been vaccinated.
Yeah, I'd say the surveillance and the prevalence testing that we did last year was really important for managing the pandemic. Those were probably the programs that gave us the most information that was actionable.
Yeah, and while our surveillance testing last semester was our high contact employees, what we'll see at this time is essentially, as Marie said, any employee that's not submitted their data, their registration or has an exemption will then, so we'll actually be expanding testing come the fall semester.
Okay. And there are elements that I want to make sure our students and families are aware of as well when it comes to exemptions. If a student is exempt from doing it, there's an understanding, sort of a caveat, that in the event that there was an outbreak or this an order from the State Health Commission that requires people who are unvaccinated to be removed from an environment. Dr. Bissell, can you elaborate on that?
Yes, in a public health emergency, which if you had a huge outbreak, given what our numbers have been, the state health commissioner can issue an order that those who are not vaccinated for that communicable disease be excluded from school. And it would be the same for higher ed. So if you had a contingent of students who are not vaccinated and we had a huge outbreak on campus, in the community where we felt like it was a public health emergency, we could get an order from the commissioner to exclude people from public schools, from private schools, from institutes of higher education.
And that falls in the category of full disclosure. We just want to make people know when they're making a decision that they understand the pros and cons.
Sure.
And that's one of the, hopefully, remote situations, not very likely, but we want people to know that that is a possibility.
No surprises.
No surprises, yeah.
What, if anything, will happen if students don't comply? I know there's a deadline, August 6th, we've shared.
Yeah, well, I think it's really important, and I just want to emphasize, go back to what President Sands said at the very beginning, is first, a huge thank you to our community. Our community has responded in a remarkable way at every stage, and so this is just one more chance for us to step forward, and like Dr. Bissell said, protect those who do need a medical exemption and do have sincerely held religious beliefs. So when we do that, we really protect the most vulnerable in our community, and that's what we have done over and over and over again the past 15 months. So that's huge. So thank you for continuing to do that, Hokie community. It's important that students know you have to have an exemption or be vaccinated in order to return to campus. If you don't have an exemption, are not working with us, or you haven't been vaccinated, you won't be able to move into the residence halls, one, and two, you won't be able to come to your, you'll be dropped from your classes if that's not taken care of before the school year starts. So it's incredibly important that people pay attention to that August 6th date so that they can turn in their exemption form and receive an exemption, or turn in their vaccination records. And I do have good news. As of this morning, we've just started doing this. We already have 5,400 students and 3,200 employees who have already provided verification of being vaccinated. So we're off to a really great start. And we hope that people are doing that as soon as possible, is turning that information in so we can monitor progress.
And I just wanted to share, and Dr. Bissell, if you can touch on this, and perhaps the information is still the same, which I believe it is, in terms of meeting that deadline. There are some logistical considerations for when you get the vaccine and how it's spaced out time-wise. Can you talk about that so that people can plan for that so that they can meet the deadline?
So the Johnson & Johnson is one shot and done. Both the Moderna and the Pfizer are 2 shots. Pfizer, they want to be at least 21 days apart, ideally between 21 and 42 days, and the Moderna, 28 days to 42 days. And remember, you're not considered fully vaccinated for 2 weeks after the second shot or 2 weeks after the Johnson & Johnson. So it really does look like if people are going to be considered fully vaccinated returning to campus in August, that they really want to jump on that now. And I think we were talking about certainly by 4th of July, early July, so that they have time to get that second shot if they're doing a 2-shot series, and then have those 2 weeks that they're really considered fully vaccinated when they return to campus.
And what are the public health guidelines or requirements for people who are not fully vaccinated or are unvaccinated?
So they would be the same that we had all through the pandemic, the 3 W's. We would want people washing their hands, which we hope everybody will do, wearing their mask and watching their distance. In Asia, they really talked about avoiding the 3 C's, which is crowded spaces, close contact, and closed spaces. So you really just want to use those common sense public health precautions, and then also stay home when you're sick, you know, and everybody should be doing that. But people who are not vaccinated really need to exercise those precautions, whereas people who are vaccinated, you know, we have good data, we can relax those precautions. Even indoors in smaller spaces, people who are vaccinated don't really need to be masked up, you know. But they may want to, just to be careful if they have somebody unvaccinated around them or whatever. You know, it doesn't have to be an absolute. The other thing I would say is, as far as quarantine and obviously isolation, people who are vaccinated, if they're exposed to a COVID positive individual, they just monitor for symptoms. They don't have to self-quarantine. If they get symptoms, then it's recommended they get tested, and obviously they take themselves and self-quarantine or self-isolate. People who are not vaccinated, who are in contact with a COVID positive person, would have to self-quarantine, either full 10 days or 5 to 7 days, and then get a negative test before before they could come out of quarantine.
Okay. What about people who have previously tested positive for COVID in terms of getting the vaccine, and should they or shouldn't they? When should they, if they should?
So the CDC does recommend that people who've had COVID go ahead and get the vaccine, because we really have good information that the vaccine provides a durable immunity. People who've had COVID who maybe were asymptomatic or mildly symptomatic, we don't have a lot of data on that, and we have to continue to follow it. So the current guidance is if you had a mild case of COVID, you can get vaccinated as soon as 10 days, which is your 10-day isolation period. You can start the vaccination series. You can wait a little bit longer, up to 90 days if you want, but they really do recommend it that between that 10 and 90 days that you at least start and get the vaccination series going. People who had a more severe case of COVID, who ended up hospitalized, who got the passive antibody therapy, they do recommend waiting 90 days and then still getting vaccinated.
And I just want to be clear about that point, because a lot of people are asking about that waiting period, but that is for a smaller population of folks.
People who were really seriously ill, people who were mildly ill or not at all ill, after their 10 days of isolation, it's recommended that they go ahead and start and get the vaccine going.
Okay. Mike, I know you touched on this earlier. You were saying that you're still working on the plans for the testing and what that will look like for folks who are not vaccinated. Is there anything that you can share about that process and when you might know or what that might look like? Is it similar to what we saw in the fall and in the spring and in the last fall?
Sure, be glad to. So obviously the best plan is for the most of our employees and staff and students to be vaccinated. That's what we like to see happen first. But for those who can't, or those who for some reason don't, we will essentially use the testing strategy that we used in the fall. We will for employees, we will expand what was our surveillance program. And again, that program was testing every couple of weeks. We'll probably shorten that time frame. And again, to make sure that we don't miss something in that population. Because again, in last year we were primarily remote. There were less people on campus. The density on campus is going to be much greater. So there's going to be a need to do additional testing for those populations to make sure we don't have breakthrough and we end up having an outbreak on campus. So that's what we're finalizing now, the logistics on how we will implement that. But we've got a lot of experience on how to do that from last semester. So we're very confident that we can run a fairly rigorous, efficient testing program for our community.
And we all heard Dr. Bissell talking about the need to maintain physical distancing, wearing masks, washing hands, of course, if you're not vaccinated. And I know those same protocols will be in place on campus, but what will that look like from an experience perspective for students, for any activities in classroom experiences? What will that look like for folks who are coming back, knowing that there may be some students who have an exemption? Frank, I don't know if you want to take that.
Well, I think everything that we're doing and everything that we're talking about right now is to prepare for an experience that looks a whole lot like the Virginia Tech pre-pandemic. So that's why it's so important that we get on board with getting vaccinated, and the number of people who get vaccinated, the better, which provides protection for those who have sincerely held religious beliefs and need a medical exemption. So we protect them. And with the exception of people wearing masks if they need to, we fully hope that it looks like the Virginia Tech we all know and love before the pandemic. So residence halls will be back to their normal capacity. Campus recreation will be back to its typical capacity, as will the dining centers. Student organizations and other kinds of events will be back. And you heard this week that the football stadium is going to be full again. So these are all wonderful things, and they're thanks to the efforts of an incredible community. So we're just taking this next step to get there, and we're getting close.
I think if we can get almost completely vaccinated, which is the goal, we will have a wide open fall semester. I'm confident in that. I think that the challenge gets to be if we have a large number of individuals that aren't vaccinated, we need to accommodate them. it starts to complicate the scenarios that we would consider to be safe. So we're hopeful, and the assumption right now is that we're going to get to that nearly full vaccination level so that we can have a fall like Frank described.
Sure.
But I wanted to emphasize that we're going to follow the data, we're going to follow the pandemic, and if things change, if guidance changes, we're going to adjust our guidance as well. So we kind of know what our starting condition would likely be if this were the first day of the fall semester. We know what we would start with. We hope that by the time we get to mid-August that almost everyone's vaccinated. We know what that will look like if we do get there. Anything in between, we're going to have to, it's going to challenge us. So that's why it's so important that people, if they can get vaccinated, that even if you plan to load up your card sometime in the future, the earlier you do it, actually it has a huge impact on our planning, because every day as we get more and more reports of who's vaccinated, who's reported, it narrows the range of scenarios that we need to work with. And so I'd urge everybody to, if you have been vaccinated, go ahead and load up your card today. It takes a couple minutes on your phone or on a website. Please. And we will be able to let people know. We're working on a dashboard so that you can kind of see the progress of the community as we approach full vaccination. And if we get there or get close, and I think we will, we're going to reap the rewards as a community.
You mentioned accommodating those who might not, who might have an exception or an exemption rather. Frank, can you talk about what that would look like for those students? They will still have the same opportunities to experience the community as others, right? 100%.
I mean, we want everybody who is a part of the Virginia Tech community to be able to experience Virginia Tech fully. And just to reemphasize what President Sands is saying and what Dr. Bissell has said, you know, what this community does is protect the most vulnerable people. And so the more we get vaccinated, the better that we're able to protect those people so that they can have the full Virginia Tech experience. Over and over, what we've all done is sacrifice a little for the greater good, and this is just one more chance to do it. But what's important to say is we want everyone to have the full Virginia Tech experience, even if you have a medical exemption or a sincerely held religious conviction. We want you to have the same experience as everyone else.
Yeah, I think the first few weeks are going to be critical of the fall semester. We saw that both fall and the spring, that we had surges in cases. We had about, I think it was around 3,200 student confirmed cases between those two semesters, and many more that we don't know about, I'm sure. But once we get through the first couple of weeks, we'll be turning to Dr. Bissell and her colleagues to advise us as we look at case numbers in the region, and we look at hospitalizations and hopefully no deaths. And if we see those numbers go down to zero and hang there, it'll give us a chance to even open up further. So I think I guess my message is that stay tuned. It's our goal to get there a fully open fall semester, but we're going to be listening to what we're seeing. We're not going to just go blindly into the fall. We're going to pay attention to the data as it emerges. And hopefully a couple weeks in, we will see that there's nothing going on with COVID, and we can hopefully declare victory. But that'll be up to our colleagues in public health and the medical profession to guide us.
Frank, you touched on earlier dining halls being back to normal operations. Can you talk about some of the other things that will be back to normal, so to speak, in terms of the experience and what that will look like? Welcome week, orientations, typically we're talking about that this time of year. What will those things look like?
Sure, and I think it's important to acknowledge the last 15 months have been really hard, especially for our young people and their well-being and their mental health, and so getting people back together and having the full experience is incredibly important. There's a particular group of students that I'm worried about, and that's our rising sophomores, because they didn't have the welcome and entry into Virginia Tech that our new incoming class will. And so Welcome Week is August 16th to the 23rd, and I want to say to our sophomores, we want you to participate in Welcome Week so that you can matriculate to Virginia Tech like we wish you could have matriculated last year. So there'll be lots of events, and we're hoping our sophomores will participate just like our first-year students will, so that we can give them the warm, hokey welcome that we would have rather than had last fall if we weren't in the middle of a global pandemic. But otherwise, I think you'll, again, with the caveat that President Sands continues to emphasize, we got to keep people safe, but assuming that we move in that direction and all the data is pointing in the right direction, it will look like a pre-pandemic Virginia Tech, and that's pretty exciting.
How do you prepare for students who are returning but haven't had, and not just freshmen, but sophomores and upperclassmen? Is that still a term?
Yes, yes.
How do you prepare for those folks who have not been back? And all of us really, you're not used to socializing and being around many people like we were pre-pandemic. How do you prepare for that to make sure that we stay on track and we don't swing too far in the wrong direction?
Yeah. Well, anyone, feel free to jump in here, but I think we're all experiencing this, the reacclimation to the world we once knew. It took us a while to acclimate to a pandemic era, and it's going to take us a little while to return. So I guess my best advice is to be patient with yourself. We're all a little bit different. We got to calibrate to who we are and what our individual needs are. And then I think the key thing is to be open and honest about how you're feeling and to get the support that you need around you. So we've got great people at Virginia Tech, a great counseling center, lots of people who want to meet you where you're at and to help you matriculate and become acculturated to the new Virginia Tech. So be patient with yourself, be honest with who you are, and share your need for support, and be open to that.
I think it's important to point out, too, that we aren't returning to exactly Virginia Tech from, say, 2019. We're trying to approximate that, get as far as we can to the in-person experience, and I think we're going to get virtually all the way. But there are some things we learned during the pandemic that I think will make the experience even better. We were just talking about, with Marie, about the counseling, some of the counseling work, the academic counseling and support is better done remotely. The students prefer it. And there's certain things like that where I think we're going to be able to come back even stronger than we were before the pandemic.
Maria, go ahead.
Go ahead.
I was just going to ask you if you could talk about, while we are talking about getting fully in person or as close as we can to that, if you could talk a little bit about options for people, particularly employees, obviously, that may want to still do remote work and what that looks like.
Right. So the most important thing is, what is the role or the job that that person does? So for those that support students and support faculty, we want to have that same in-person experience for students and faculty. So it comes down to having a discussion with your supervisor as to what your role is, and then also what is the responsibility of that department. So none of us do the same job, and it really is a conversation that needs to take place. I wanted to add that, as employees are coming back, we also want to have grace with each other, because some will still be wearing masks, and we just want to recognize that that's okay too.
Great, thank you. I wanted to give each of you an opportunity before we wrap up to offer some closing thoughts. A couple of key takeaways: get the vaccine if you haven't already. If you've gotten it already, to upload your information to verify that you've done so. And Frank, as you just pointed out, ask questions. If you need support, reach out, ask questions. But I'm wondering if maybe we can go down the line, and Marie, I'll start with you to share any final thoughts or information that is important for people to know.
Certainly. Well, the work environment certainly changed during COVID. But as we come back together, it's so exciting to see people again. This has been a great experience here on the stage, and we want all of our employees to feel that experience and how positive. So it is important to get the vaccine, and if you haven't done so, but if you have, let's get it uploaded and be counted in the mix so that we can start seeing what it really looks like here on the campus.
Mike?
Sure. So maybe I'll share a personal story that I haven't shared with anybody yet. And so last fall we had a family event, and ended up being COVID positive from that. And several that were at the event were also positive, including my 85-year-old in-laws. And where I'm going with this, while it was not a lot of fun to be sick, and there was anxiety with that, the real stress was knowing that our elderly relatives were sick and that we could potentially lose them because of this. And where I'm going with this is what I really want to urge everybody to do: the right thing. And the right thing is to get vaccinated. And if you can't get vaccinated, or until you can get vaccinated, wear your face covering. Do the 3 W's that Dr. Bissell talked about, because it really makes a difference. And again, if you're not that concerned about your own health, certainly be concerned about those around you, whether it's your coworkers or your family. Because again, it creates some very anxious times should COVID visit you and visit your family.
Thank you.
Yeah, Dawn, I think I'd close with saying it's such a deep privilege to work at Virginia Tech, and especially to work with Virginia Tech students. They are serious about our motto, Ut Prosim. They really do understand that when we have the privilege of this kind of education and we can use it to go make the world a little better with our lives and in our communities, that the whole world gets a little better, and that's a pretty remarkable thing. And so I love what Mike is saying. We've got to continue to stay in the lane of what do we do for the better of the entire community. The fall is going to be terrific because we've got the kind of community that really wants to make a difference, and be excited about that.
Thank you. Dr. Bissell?
So again, I would reiterate, vaccines save millions of lives every year. And the whole reason we developed vaccines was to prevent the devastation from infections like COVID-19. That's the whole reason they came about. And it really is a tremendous effort on the part of everyone involved that we went from genomic sequencing in early January to having a vaccine before the end of the year. I mean, that's just a tremendous accomplishment. And it really has made a major impact on the outcomes of this pandemic a lot sooner because of that. And, so we need to celebrate that. We need to celebrate our successes, and we need to look at what the vaccine has done for our getting back to normal. There are things, though, the washing the hands and certain things that we do want to continue to use. We in our armamentarium of how we can stay healthier as a community. And the other thing is just keep perspective. I'll say that social media, there's a lot of misinformation out there. Please go to trusted sources for information. Call the health department, call a respected primary care doctor, somebody who can answer those questions and give you the information so that you're getting the good facts and not the misinformation that's circulating. And with that perspective, remember, nothing is totally risk-free. And so don't make the exceptions into the rules when you're looking at some of these things. It's really important that we look at what this vaccine has done to turn the tide in the pandemic.
Great. Thank you. President Sands?
Well, I'd like to close with a thank you. Just again, our employees, our students, our community members, thank you for everything you did through the last 15 months to keep this virus at bay, to help us get through as a collective group this incredible experience, and to preserve what's best about Virginia Tech. And as I said earlier, it's that balance of both protecting your own health, but thinking about the health of others and the health of our community as a whole. I think Mike's story is a great example of that. And I think, as Dr. Bissell said, we have a new tool, and that's going to allow us to have a fully in-person experience in the fall if nearly everyone gets vaccinated. And again, that's always going to be a balance. It's about your own health and your own well-being, but I think more importantly, it's about the health and well-being of the entire community and your role in that. So I know it's a struggle. People go back and forth, what's best for me and what's best for others. And I'm asking everyone in the community to look at both, not just one, to look at both, and to do what we think is absolutely necessary, and that's get vaccinated if you can.
Great, thank you.
Thank you.
Thank you, President Sands. Thank you, Dr. Bissell, Dr. Shushak, Mike MULHARE, and Marie Bliss. Thank you all for sharing so much information and really answering all of the questions that that our community has been asking. We appreciate it. And thank you for joining us. This recording will remain online, so if you missed a bit at the beginning, perhaps you can watch it online at the same link. And if you need any information, you can also go to the Virginia Tech Ready website and find the answer to many of your questions and information about much of what we've discussed today. Thank you.